What is blood flow restriction training?
So blood flow restriction training is where you use a cuff, which is basically a tourniquet, and it blocks blood flow going back up to the heart. And what that does is it makes the exercises much more difficult and allows you to build strength.
And how do you use BFR in your practice to help your patients?
I see a lot of post-op cases like ACLs, meniscus, where you have to be very protective early on. So we can't go and put somebody under heavy loads. And so this allows us to kind of bridge that gap, help us get that high intensity because it makes the exercises much harder, and also maintain that strength, especially in that early phase.
Give an example of how you use BFR in your practice to help a patient return to sport.
So I will usually use it in the first 10 weeks. I will use it as like the primary focus. So these patients are hooked up to BFR for almost all their exercises. Once we start to phase into like the later stage of rehab, I use it as more of like a burnout at the end of the session so that we're just getting more of that stimulus, just really pumping up that muscle.